Ontario has unveiled its Halloween guidelines, and this is disappointing news for children in Toronto, Ottawa, Peel, as well as York regions. The province is asking kids to refrain from trick-or-treating in those areas. The Premier and health officials are urging children to celebrate with their families within the household. They're encouraging creative alternatives like pumpkin carving or perhaps a movie night. Now, as for families living outside the COVID hotspots, officials recommend trick-or-treating safely. That means wearing masks, maintaining physical distancing, and only going out with members within the same household. A lot of reaction to this, of course. With more, we're joined by infectious disease specialist Dr. Isaac Bogosh. Doctor, thank you so much as always. You don't entirely agree with this. Why?
Well, in all fairness, whatever the public health authorities are saying we should be doing, I really think we should be doing it. It's that simple. So if Toronto, Peel, York, and Ottawa are going to forego trick-or-treating this year, then I'm going to forego trick-or-treating this year because I'm in Toronto. And yeah, of course, like everyone else, my kids are going to be disappointed. But those are the rules of the land, and I completely respect the rules of the land. So, I mean, it's going to be a bit of a different Halloween this year. And you know what? It's okay.
All right. So you will respect the rules. Fair enough. But you initially said that this is not necessarily a good idea. Could you clarify that?
Well, if we take a step back and we look at the big picture about, how COVID-19 is transmitted and what are the risks of getting COVID-19 with certain events, you'd think that something like trick-or-treating, if done fairly and if done safely, can be done in a pretty reasonable manner. If you stay within your family units, if you avoid large crowds, put on a mask, spread apart, then you can really do this in a very safe manner. I think the risk of getting COVID-19 in a situation like this is remarkably low. Of course, nothing's 100 or 0%. Of course, it takes situational awareness for a parent to help their kids avoid going up on perhaps a doorstep if there's another family there. But in all fairness, it's a pretty low risk thing. I mean, we've been told stay outside, put on a mask, be 2 meters apart, and avoid crowds. I mean, that's kind of trick-or-treating in many, of course, not all settings, but in many settings. So it is on the lower risk end of the spectrum. And like anything else, there's going to be some families that are going to say, you know what, this is not for us this year, and that's fine. But of course, we know that some families are going to do it regardless of what the public health guidelines say. And I think it's important that they have strategies to do so safely.
And you're not the only one. You're not alone, certainly, in your medical opinion. Last week, Dr. Theresa Tam, the Chief Public Health Officer for the country, said Halloween should be able to continue. And obviously, she, accounts for Ontario in that. And at that point, if I'm not mistaken, the numbers were even higher than they are now. And who knows what they're going to be in 2 weeks. So you understand the confusion here and how people should go ahead with this. And even the City of Toronto spokesperson, Brad Ross, we have this tweet saying this is advice. There is no law or bylaw prohibiting it. So therefore, no law or bylaw to enforce. How do you respond to all that? And trying to, as an average Ontarian, trying to make sense of the conflicting advice?
Well, how about, Anthony, that we've been, this has been an issue, I think, long before Halloween. And it would be wonderful to have, more coordinated advice, more focused or streamlined advice, and certainly coordination between the various federal, provincial, municipal levels, and coordination between government officials and then public health officials. So obviously, this is not unique to Halloween, unfortunately. But of course, it's Halloween. It's the best night of the year, and everybody's watching this closely. So I think it's just being magnified here. Maybe we'll hear some clarification from the local public health leaders, from the provincial public health leaders. There's still, about a week to go. But yeah, I appreciate that there would be some confusion because, in all fairness, there have been some mixed messages with regards to this.
So much of it, of course, relies on the numbers. And I'm curious if there is a determining factor in this and what the tipping point would be and for how long that number would have to be at that for these restrictions to ease. Is there a discussion behind closed doors? What do we have to look forward to as at least a benchmark to give people some hope?
Well, for Halloween in particular? Or
no,
just
in general. in general?
Oh, well, we really need to start to see, first of all, our rates are still kind of climbing. It's hard to tell exactly what they're doing in Ontario, for example, just because the number of tests per day are somewhat restricted. And we know that the method in which people are going to go get diagnostic testing done really involves a booking online. It might involve waiting for a couple of days. So this is very likely turning many, many people away. So we're probably not getting a full picture of what the ground truth is. Having said that, those numbers aren't completely meaningless. And what we really want to see in Ontario is at least a plateau in those numbers. And then, just like with the first wave, we want to start to see a sustained reduction in the number of cases per day. Keyword there is sustained as well. This has to be sustained over time. We're not looking at day-to-day blips in data. We're looking at a sustained reduction in the number of cases per day. And I don't think we're going to see that for a couple of weeks after these restrictions were imposed. It usually takes a couple of weeks for that to really show itself. But when we start to see that, I think maybe the senior political and public health leadership will think about revisiting some of the policy that we have.
All right. We have to leave it there, unfortunately. Up against the clock, infectious disease specialist Dr. Isaac Bogoch. We appreciate your time as always.
Have a great day.